Why are you making all these changes?
Why is planned care only on one site?
How are all these changes going to benefit me and my family?
I've got my own views on this. How do I get involved?
Planned care is something that isn't an emergency. It's usually patients that have already been assessed and seen by either their GP or a consultant within the hospital and have a procedure that's planned for them to come into hospital to have it done. So it can be anything from a knee replacement, it can be eye surgery. The benefits for having planned care on one site are that we've got our nursing staff and our support staff that are trained in delivering care along every bit of that pathways, from the pre-operative side to the recovery side and the post-operative care. In terms of how that would work for the patient and their experiences, the benefits around length of stay, they wouldn't have to spend as long in hospital, and we would anticipate there'd be less disruptions to the care that's delivered. We sometimes have to cancel some of our elective procedures now because we have emergency cases coming into either theatre, or we might have some medical patients that need to use some of our beds on our surgical wards. And so obviously the consequences of us having to cancel isn't good. You know, it's a big impact for them. By having planned care all in one place and the emergency care in one place, you can have all your specialist resources on that site to become a centre of excellence, really. You know, most nurses want to deliver really high quality care, and this model will enable us to do that. I think it's really exciting because we'll have an opportunity to design something that's bespoke, and the clinicians will be able to work alongside to get a centre that's really fit for purpose. Certainly from the planned care and the surgical perspective, there'll be 10 brand new theatres that we'll be able to utilise to deliver the best care for our patients. I think it's always really important that we listen to what our patients and our service users have got to say, and there's an opportunity now for us to really hear what they've got to say by them completing the survey that's available, and I think we should encourage people to do that so that we can get the views of everybody in the local population that are all really clearly passionate about the health services that we deliver.